All right, we're going to talk about section 5 of chapter 1 for A&P now. And the learning objectives for this particular section of chapter 1 start with the 10th learning objective, describing the anatomic position and its importance in the study of anatomy. We must be able to describe the anatomic sections and planes throughout the body, and describe the different anatomic directional terms, and identify the major regions of the body using proper anatomic terminology. Okay. And going further, describing the body cavities and their subdivisions, and there are a few, explaining the role of serous membranes in the ventral cavities, and comparing the terms used to subdivide the abdominopelvic region into 9 regions or 4 quadrants. Okay. Starting with anatomic position. Anatomic position is essentially home base, if you will, a common reference position, starting position if nothing else has changed or nothing's been affected in any way. The characteristics of the anatomic position or anatomic position, unlike anatomical neutral, which is more of a physiology term for exercise physiology, anatomic position, more from an anatomy and basic physiology perspective, is upright stance, so you're standing upright, feet parallel and flat on the floor. Upper limbs are at the sides of your body. Your palms face anteriorly, so they're opened up toward the front, which means really the forearm is supinated, or the antebrachial area is supinated open. Head is level, and the eyes look forward. Okay, that's anatomic position, a common reference. And as far as slices of the body, which are called sections or planes, a section's actual cut or slice that exposes internal anatomy, making a cut, right? Plane is an imaginary flat surface to give us an idea of what perspective we're getting in that cut. And we'll talk about the different planes here. The coronal or the frontal plane. There are 3 basic planes, three dimensions, right, of space, three basic planes. Coronal or frontal plane, the vertical plane, basically divides the body into the anterior and posterior, going through you sideways here, and dividing you in the anterior and posterior, or ventral and dorsal, okay? The transverse plane or cross-sectional plane goes right through the middle of you, and divides you into superior and inferior parts of your body. And then you have a mid-sagittal plane, which goes right to the middle of you forward here, dividing you in basically my right and my right and my left over here, equal plane, equal halves. Whereas a sagittal plane could be to the left or the right, either way, of the mid-sagittal plane, and still be a sagittal plane cut. Okay, and then the oblique plane is basically passing through the structure at an angle of some kind, not a direct coronal plane cut, not a direct transverse plane cut, not a direct mid-sagittal or sagittal plane type cut. Okay, we'll talk about that more in a second too, to give you a little better idea. Here's a basic picture for the human body here. This lady here, the coronal plane going right through the middle of her this way, right, dividing her in anterior and posterior, or ventral and dorsal. And then the transverse plane going through the middle of her, dividing her in superior and inferior, or top and bottom. And then the mid-sagittal goes right through the middle, dividing her into left and right. Okay. And here's some basic looks at a cut be similar, typical mid-sagittal or sagittal type plane cut, and an oblique plane, all depending on what direction where this organ was, right, where that cut's coming. In this case, though, this is oblique, it's at an angle, right? It's not a direct mid-sagittal going right through the middle, or transverse cutting right through the middle, top and bottom, or coronal going right, dividing front and back. Okay. And we'll talk more about some of these terms and referred to anterior, posterior a little bit, dorsal and ventral. Now we also have proximal and distal for specific directional terms that describe relative positions. Okay, anterior is to the front, posterior to the back, superior is above, inferior is below, medial is toward the midline, and lateral is toward the outside, or laterally going away, right? Medial aspect of the inside part of your thigh, lateral being the outside part of your thigh, if you will. Okay, or femur, if we're getting to the technical, the bone. We'll get to regions, of course, for the appendages later on. For proximal, these arrows are kind of deceiving a little bit here, but proximal being closer to a given point, distal being farther away. Okay, an easier way of looking at it is from a standpoint of, if you're talking about your shoulder, your elbow is more proximal to your shoulder for the deltoid in the regions here, but very basic terminology would be like your elbow being closer or more proximal to your shoulder, and wrist being more distal from the shoulder. Okay. The human body is divided or partitioned into 2 main regions, your axial and your appendicular. Your axial is your head, neck, and trunk. Some people call it torso, okay? It forms the main vertical axis of your body. We don't want to call it torso, call it axial region, right? When I say it's also called, don't use that one. Use the primary term we use. But the axial region is the head, neck, and trunk, and the appendicular is your limbs, your appendages, right? And there are more regions, of course, within these two. And this slide right here is showing the basic regions, the cervical, which is like basically your neck region here, your cephalic, your head, your thoracic, which is kind of the upper region of your torso, so to speak here, abdominal being more toward mid-region, and pelvic below it, right, for the upper extremity, and then basically the lower extremity being more toward the femur, and of course the knee and the tibia and the fibula. I'm not going to go point for point through every single one of these terms. I need you to look at that and to make sure you understand where those locations are. You'll need to know it for lab, you'll need to know it for the class, and you'll just need to know it because it's important to know. But I'm not going to go through all those terms. A lot of terms to go through for me just to repeat for you when I want you to be repeating that yourself. If you have difficulties with pronunciation at all, or you're not sure how to pronounce something, I know you know it. It's simple Google, right? You Google the term and you say deltoid pronunciation, and it'll tell you deltoid, right? So you know how to pronounce it, okay? Simple, easy to do. That's by recommendation. You can ask someone, but I'd best to actually hear that pronunciation said. And with very few exceptions, it's pretty accurate. Same with the posterior view for the regional terms of those same regions. You're responsible for those, okay? Whether you're quizzing yourself by looking at these slides here and pausing the video, or using your textbook, however you do it, okay? At some point, you'll have arrows pointing these regions, and you'll have to identify them. As far as body cavities and membranes, the internal organs are housed within enclosed spaces or cavities, all of your internal organs. And these body cavities are named according to the surrounding structures. The body cavities are divided into the posterior aspect and the ventral cavity, right? The posterior aspect, back, right? Completely encased in bone. It's physically and developmentally distinct from ventral cavities. And it's subdivided into your cranial cavity, okay? For the head here, formed by the bones of the cranium. And of course, you should know your skull is not just one big bone or you'd be in trouble. A lot of smaller bones compose your skull. And that houses the brain. The vertebral canal is formed by the bones of vertebral column, basically your spinal cord, where it's housed, housing your spinal cord. The ventral cavity is larger than your posterior cavity by a lot. Okay, it's everything anterior, that spine essentially, and it's anterior placed in the body, does not completely encase organs in bone. It's partitioned into your thoracic and your abdominopelvic cavity. We'll take a look at some images here shortly with this. Significant difference between your posterior aspect and your ventral cavity is this something called serous membranes. Okay, there are two layers of these serous membranes. There is a parietal layer, which aligns the internal surface of the body wall, and you go deeper, the visceral layer covers the external surface of organs, your viscera, okay? And the serous cavity is the space between membranes. You have these layers, and the space between them, between layers, is going to be your serous membranes, okay? And the serous fluid is liquid secreted by your cells within the serous membrane, and acts as lubricant. It reduces friction caused by movement of organs against the body wall. You wouldn't want your organs to be perfectly, completely fixed. They would never move and be completely immobile. Just like you don't want to be completely locked into your seatbelt in your car where you can't move at all. You're more likely to cause more damage that way by having completely stiff versus allowing some motion. Like a building that's for being earthquake proof. It needs to give a little bit. It can't be completely rigid, or it's more likely to be more damaging to the building when an earthquake occurs. Now, these body cavities, a little better picture here now of what we're talking about. That posterior aspect for the basically cephalic region of the head here, cranial cavity housing the brain, the vertebral column here going through here, the vertebral canal where basically essentially your spinal cord would be. And then for the ventral cavity here, the thoracic cavity is the uppermost region of or the most superior region, I should say, of the ventral cavity with your thoracic diaphragm right here. And that's a separating point, or a little below that. Then we have our abdominal cavity, I should say. Below that thoracic diaphragm comes the abdominal cavity, right in there. And then we have the pelvic cavity, both part of the abdominal pelvic cavity of the ventral cavity. That's a mid-sagittal view cutting you this way, right? And they have a coronal view, so cutting across this way. The mediastinum, I should say, here. And then we have a part of the thoracic cavity, the pleural cavity, for basically the lungs, the pericardial cavity for the heart, okay? Thoracic diaphragm, obviously for the diaphragm there, and basically the abdominal cavity, this whole region here, and the pelvic cavity for the pelvis, part of the abdominal pelvic cavity. And these body cavities membranes, serous membranes, are arranged like a fist inside of a balloon. It's a pretty good description and a pretty little image to help you out. That fist represents your body organ, okay? And the balloon represents a serous membrane around that organ. The outer balloon wall is comparable to your parietal serous membrane, okay? And the air inside there, inside that parietal serous membrane, inside that balloon, is comparable to a serous cavity. And then the inner balloon, and then basically the inner balloon wall inside is comparable to your visceral serous membrane, okay? The spaces and structures within the thoracic cavity. The mediastinum is a median space in the thoracic cavity. It's where your heart is, your thymus, your esophagus, trachea, major blood vessels that connect to the heart. Your pericardium, your two-layered serous membrane for the heart. It's basically the parietal pericardium, the outer layer, which forms a sac around the heart. The visceral pericardium, which forms the heart's external surface, okay? And we'll see a picture of this here and again in a moment here. The pericardial cavity, which is the space between the parietal and the visceral layers containing the serous fluid. The pleura, basically for the lungs here, the two-layered serous membrane associated with your lungs. The parietal pleura, which is the outer layer lines for the internal surface of the thoracic wall. The visceral pleura, inner layers covering the external surface of the lungs. Pleural cavity, space between the parietal and visceral layers containing the serous fluid. And so here we are. Here's the heart, okay? And then you have the parietal pericardium out here. And you have the pericardial cavity with the serous fluid there. And the visceral pericardium inside there, okay? And the parietal pleura for the lungs on the outermost portion there. Visceral pleura, the inside there. And then you have the pleural cavity between them with serous fluid, and thoracic diaphragm here. The body cavities and membranes for the abdominopelvic cavity, spaces and structures to be found there. Your abdominal cavity is superior area of the abdominopelvic cavity. Contains most of your digestive system organs, kidneys, and most of the ureters. Your pelvic cavity is the inferior or below area between your hip bones. It contains the distal, closer, or farther apart, of the large intestine, remainder of the ureters and the urinary bladder and the internal reproductive organs. Now, the abdominal cavity includes your peritoneum, which is a two-layered serous membrane lining the abdominal pelvic cavity, and the parietal peritoneum. The parietal peritoneum, the outer layer, which lines the internal walls of the abdominal pelvic cavity. The visceral peritoneum, which is the inner layer, covers the external surface of most of your abdominal and pelvic organs, and the peritoneal cavity, which is basically potential space between the parietal and the visceral layers containing the serous fluid. And here we can see our thoracic diaphragm here. There's a liver, there's your stomach, your pancreas is here, your large intestine, and then you have parietal peritoneum. I mess myself up. I always want to say it differently. And the greater omentum, which is basically descending down from your stomach here, okay? And small intestine with the mesentery here, which can help with forming connections there with your small intestine. The peritoneal cavity with serous fluid, and the visceral peritoneum, and then of course your rectum, where waste is excreted. And the abdominal cavity basically is partitioned into 9 compartments. Your umbilical region, your epigastric region above the umbilical region, hypogastric region below the umbilical region, and then you have left side and right side, obviously. For the epigastric, you have left hypochondriac and right hypochondriac. For the umbilical, you have the left lumbar and right lumbar, and the hypogastric has the left iliac and right iliac, okay? And then you have of that right and left hypochondriac regions, you should be able to make sure you understand that's where the epigastric region is, and the lumbar, where the lumbar spine essentially is, or the same area of the umbilical region, and the iliac has to do with more with the ilium as far as the pelvic bones there, referring to the iliac, okay? And then your quadrants are essentially your right and upper left quadrant and right and left lower quadrants. And basically that's for dividing into 4 compartments with essentially a transverse type cut and a mid-sagittal cut or plane through the umbilicus. So what you should be able to do is to identify what type of plane would separate the nose and the mouth to superior and inferior structures. You should know that. It's a simple transverse plane, okay? Which directional term would be most appropriate in the sentence, the elbow is blank to the wrist? You know, the elbow is blank to the wrist. The elbow is actually superior to the wrist. The term antebrachial refers to which body region? That was the forearm. Okay. Which body activity is associated with the lungs? Which body cavity, not body activity, crossover into my exercise physiology classes. Which body cavity is associated with the lungs, and what are the names of its serous membranes? That's the pleura, okay? And that body cavity, that pleural cavity there, okay? And that said, if a physician makes an incision to the abdomen along the mid-sagittal plane, superior to the umbilicus, above it, just inferior to the thoracic diaphragm, the skin of the epigastric, basically abdominal pelvic region has been incised. Okay, that is section 5. Section 6 up next.